Welcome to Healthcare Update with Leila Kramer. Each episode brings you informed commentary on the most recent issues in healthcare and public health, as well as in-depth interviews with prominent experts. And now, here is your host, Leila Kramer.
Hello, I'm Leila Kramer, Executive Producer for the National Library of Patient Rights and Advocacy. If you have visited your doctor for what you thought was an infection, you may have been surprised to see the doctor's initial hesitation to prescribing an antibiotic. Once an important part of the doctor's toolbox to help patients feel better if the body was experiencing infection, doctors are now rethinking the use of antibiotics because of the presence of antibiotic resistance in many patients. Antibiotic resistance has basically been caused by the overuse of medicines in both outpatient and hospital care. While respiratory infections, sore throats, and sinus infections are caused by viruses, antibiotics have been prescribed unnecessarily. This allows bacteria to actually adapt and survive the antibiotic treatment instead of the medicine killing the bacteria. This has become one of the major issues in public health. What is happening that, according to the Centers for Disease Control and Prevention, the CDC, over 2.8 million antibiotic-resistant infections are occurring every year, leading to the deaths of more than 35,000 patients. The answer to the crisis, according to the World Health Organization, is something called antibiotic stewardship, where doctors are being more careful to prescribe the right medicine for a medical condition. The stewardship program aims to ensure that the best drug is chosen and that the dose and how long the patient takes the medicine is carefully monitored. Probably the best way to illustrate this stewardship is that doctors are now shortening the time a patient takes an antibiotic. Many patients are familiar with the Z-Paks that have been taken in the past for 7 days or longer. Now, doctors are prescribing the Z-Pak for a period of 5 days instead of 7. So yes, the medical community is very concerned about antibiotic resistance and its long-term effect on the health of American patients, and the medical community, along with the public health community, are paying attention to this crisis and trying to make decisions that will help patients to react more positively to what has always been regarded as the miracle drug, the antibiotic. Patients can be proactive by having conversations with their doctors and pharmacists about choosing the most effective medications. And that is your healthcare update for today. I am Leila Kramer, and I will see you on the next healthcare update powered by the National Library of Patient Rights and Advocacy. Thank you so much.